Okay, this week's assigned reading and the oral lecture is based on Chapter 6 of your book, which talks about assessing and monitoring program processes. So this chapter is basically getting at what I refer to in our outline and in various assignment descriptions as the process evaluation. So we talk about the main parts of our class project are a process evaluation and an outcome evaluation, and this is the process part. So I hope that you're able to see this chapter as part of a larger whole. So we've talked in depth about doing a needs assessment where you assess the need to have a program, and often this is done for newer programs or even before a program has been established to justify, yeah, we should have this program in this community or even across the nation. You know, there's a need for it, and the needs assessment actually addresses exactly that, you know, the numbers, the statistics, the evidence behind saying, yes, we need a program like this. And then the theoretical piece, so the program theory assessment, gets into saying, okay, we have this need, how should we address it? And then saying, okay, if we have a need to provide services to underemployed people in a certain area, what services should be provided and how would that improve whatever the outcome is? So if the outcome is to have people gain better employment in terms of the money they're making, then you might theoretically say, well, it would make sense to have resume building workshops or places where people can get experience that would help them get a better job, or support for vocational education that would train people for specific jobs that are well paying. So theoretically, if your goal is to accomplish that objective, you know, to get people better paying jobs, then you would say theoretically, this is how we're going to do that. And we talked a lot about theory last time, so I'm not going to go into that, but just in terms of, you know, whether you're drawing on an explicit theory or an implicit theory and then assessing the theory and making that connection between the theory and the outcome through something like a logic model. And so a theory, we're not doing a needs assessment. That doesn't play into what we're doing. The theoretical piece is there. We're not assessing a theory, but it's, you know, coming up with a theory was part of your paper. So I just integrated that into the literature review, but we're not going to assess a theory because Children's Outreach Project is a pretty well-established program. So I wanted to focus more on an impact evaluation, part of which includes the process evaluation. But I hope that you're kind of seeing each one of these types of assessments as part of a bigger whole. Process evaluation looks at the program itself. So you're looking at the program's operations, its activities, the functions, how it's performing in terms of the delivery of its functions. So we're not talking about, is it achieving the desired outcomes yet? We're talking about how is the program performing relative to what it intended to do in terms of the activities, the component parts of the program, and the resources that a program uses in order to carry out its functions. A process evaluation addresses the question, generally speaking, of whether a program is delivered as it was intended to be delivered to its target recipients. So there's an issue with, are the activities being carried out the way they were supposed to? Are they being carried out at all? And then is the program reaching its target recipients? So there are a couple of different parts of this, and one is service utilization, and that is the extent to which the intended population receives the intended services. So that's service utilization, and then the second part of that is program organization, which is where you compare the plan for what the program should be doing to what the program is actually doing. And yes, the two are interconnected, so if you see some overlap there, that's good, you should. So some specific questions that can be asked. If you look at page 172 of your book, there's a whole page of them. I'm going to go through a couple of them just to reinforce it and also relate it to the activity or the evaluation that we're doing. So questions might include things like how many people are receiving services. And keep these questions in mind because you're going to be addressing these questions when you do the process evaluation. So when you're thinking about gathering data, whether it's secondary data from children's outreach project, or whether you're talking about drafting a survey, which those of you who cannot attend the site visit where we gather data are going to be more involved in drafting survey questions, or at least finding answers to these. So you might be able to find some of the information on the website, but you might want to start kind of making a list of these questions, because they are going to be very relevant, or at least many of them, I would say, are going to be relevant to the process evaluation that we're carrying out. So if possible, I would recommend that you guys start a list of the questions that you think would be useful, and then maybe modify or adapt them or add or take away based specifically on your knowledge of children's outreach project. So questions might be, how many people are receiving the services? So, and you would want to do a breakdown. So if you're talking about speech therapy, so how many preschoolers are in the school? And of the number of preschoolers, how many of them are receiving speech therapy or occupational therapy? Are all of them exposed to the Incredible Years curriculum, or is that only in specific classrooms? So how many people are receiving the services as a whole, and then specific services is a relevant question. Another one, are the people or family or organizations, whatever the unit of the target population is, receiving the services as the intended recipients? Sorry about that. Are the targets receiving the proper amount, type, and quality of services? So if speech therapy is supposed to be 3 hours a week, are the kids receiving 3 hours a week of that service? If the Incredible Years curriculum has, several different components, are all the components being delivered? Are there adequate resources and facilities to support the program functions? And Danelle talked a little bit about that when we did the site visit. I actually just received permission from her today to post that video. She apologized. There was a glitch in their email system, and it's taking way longer than she anticipated to get it worked out. So she did reply to Rob, our IT director, and he forwarded me her email. And then she also emailed me saying that it's fine for us to post the video that Rob took of our visit. So I'll be doing that shortly, sometime today. But she actually talked about, in terms of the facilities and resources, they definitely have a lot of fabulous resources, but one of the difficulties they face is that the building has some issues. And you guys can talk a little bit about that. And possibly demonstrate a need for them to receive funding to either renovate that building or to change locations. So that's actually something that possibly can come out of our evaluation. Is the program organized? Do the staff work well together? Are the participants satisfied with the services they're receiving? Are the resources that a program has, are they being used effectively and efficiently? And you'll have a sense of that even just by looking at the video of the tour. You can see the use of space and the use of some of the resources they have in terms of personnel and equipment and things like that. And, parent education room, and they had, the big sheets with markers where they could write down information for the parents during the parent education programs. So take a look at page 172, take a look at some of those questions and see what you can do with them in terms of either just rewriting them or modifying them or expanding upon them, and then maybe document where you think you can get the information. And it might be as simple as, hey, someone's going to construct an email to Danelle and just ask her some fact-based questions. And some of the questions might need to be, we're going to use this on a survey to staff members or to therapists or something like that. So I would start making notes as far as where the types of data you want for the process evaluation, and then where you can get that information. Process evaluation requires making judgments. So, and this is something that we need to be very careful about, and any evaluator would. So when you're making judgments about a program, those judgments can have pretty serious ramifications. It can affect your relationship with the person or the other stakeholders. It can affect their reputation depending on where the results are disseminated and to whom they're disseminated. It can affect, if the evaluation is public, which ours I don't think will be, but if it is, it can affect possibly a program's funding. So the way that an evaluator makes judgments is actually hugely important, and you need, as an evaluator, criteria to make or inform those judgments. And the criteria can be different. In part, they're probably going to be theoretical. You're going to assess it based on degree. So when you're making an assessment, you're probably not going to make a judgment like this program is a miserable failure, or the program's perfect, it's completely successful. There's no recommended changes. Oftentimes, the issue is going to be one of degree. So the extent to which a program, fill in the blank, operates the way it is intended, is delivering services to its target populations, the extent to which it is using resources effectively and efficiently. So again, you're not going to be making sweeping blanket judgments unless there's a complete absence of something. So if, part of the curriculum is parent education and the school just wasn't doing that, then you would say, this is an integral part of the curriculum and the school isn't doing it at all. So that would be a blanket. There's no extent to which or degree, it just is lacking. But that's pretty rare to get. And yes, the program is doing something perfectly, or it's not doing it at all. So usually you're making an assessment in terms of the degree to which something is happening. Also, you can use, we talked about theoretical standards. In process evaluations, you also can establish administrative standards. And the administrative standards are usually just a goal or an achievement level that a program administrator sets up. And that program administrator might base the criteria on past experience. Maybe, last year we accomplished this, so our goal this year is to accomplish that, which is a little bit better, or even just meeting the same standard. So it can be based on past experience. It can be informed by comparable programs. Okay, so we have this other similar program and they saw a reduction in delinquency or homelessness or whatever the social problem was that they were trying to remedy. We saw a 50% reduction in the first year. So based on that, our goal is also a 50% reduction in the first year. So they can use past experience, comparable programs, or just professional judgment. We think that, if it's a program trying to improve test scores in a school, then someone's professional judgment might say, we think that students of this age group or grade level should exhibit this level of competency. And that's just based on a professional judgment call. Process evaluation provides information about program performance to program managers and other stakeholders. A process evaluation can be done by itself. It does not have to be part of an impact evaluation or done in conjunction with an impact or any other type of evaluation. There are plenty of evaluations that are just process evaluations. Typically, that tends to be the case when a program is newer or there's very little information about its processes. It also can be done in conjunction with other types of evaluations, commonly an impact evaluation. And that's what we're doing. We're doing what's primarily an impact evaluation, part of which includes a process evaluation. And oftentimes, if you're doing an impact evaluation, having a process component, even if it's a small part of it, is a pretty important supplement to an impact evaluation. And your book talks a little bit about that. Program evaluation can also involve continuous monitoring of indicators of selected parts of a program. So this is something where if you had access to a program over time in an ongoing relationship, you might monitor indicators over time. So if you see something like a gang reduction initiative in a city, you might monitor different forms of gang activity or crime or other associated outcomes, or I'm sorry, not outcomes, aspects of the program, so it might be, I'm trying to think of what they've actually done with the gang reduction initiatives. I don't remember any specifics right now, but whatever the activities included. So if they had whether it was an after school program or a curfew laws, or anything like that, or let's say curfew laws, then they would actually monitor, okay, over time, the compliance with the curfew law. Was the curfew law being enforced over time? So if you had X number of people monitoring all of these specific areas for curfew violators, and you started monitoring that monthly, you would continue to monitor that monthly. And that would be an example of a process evaluation that occurred over time. So that's continuous monitoring of an indicator. Ours, we're not doing that. We're just doing a one-time evaluation. An evaluator, so your book talks about the importance of a process evaluation to different people involved in the process. So the person doing the evaluation, the evaluator, needs process monitoring to explain why a program did or didn't work, or why, if it's failing in a certain area, why that might be the case. It's also necessary to provide information to program sponsors or funders. And primarily, that's inherently a good thing to do, but it does ensure, or at least maximize, the ability for accountability and integrity to say, okay, if a sponsor or a funder is investing money or other resources into a program, to ensure that the program is fulfilling what it said it would. Process monitoring is also good for program managers. Again, just like it for the funders, it provides the program managers with information and with accountability and integrity. And it also facilitates their ability to take corrective action if there are flaws in the implementation or in reaching the target population. Trying to meet everyone's needs, though, the evaluator, the program manager, and the funder can raise issues over, what information to gather, how much information to gather, what information should have priority, what level of confidentiality or anonymity should be ensured, how frequently can information be gathered. And you can see, these questions came up even for us, and there's not a conflict at all, but just a question of how many times can we visit the site? How much time is Danelle willing to give us? How much time is her staff willing to give us? What type of time are we, I don't think she wants us to go in and do, at one point I had suggested maybe doing a journal as we did observations. And I don't remember she directly vetoed it, but I was under the impression that that wasn't something that she wanted us to do. So she instead said, okay, I'll give you access to files if you can guarantee anonymity or confidentiality. And I had to draft a document for her about that. So yeah, there are issues in terms of privacy, what information people have access to, and under what conditions, and that's something that needs to be worked out. Now, ours is a completely collaborative relationship, so that was very much whatever Danelle wanted or asked for. I said, we'll definitely work with you. In other places, it's not like that. If an evaluator is being paid, if there is a funder involved, then the program manager might have less say in what goes on. And the book talked about that at the beginning. So if you have questions about that, you can ask, or just go back to the beginning of your book, because it did talk about some of those relational dynamics and the implications of those. So your book then goes on to talk about monitoring service utilization and monitoring organizational functions. So when we're talking about monitoring service utilization, we're talking about the extent to which intended targets receive program services. So this involves questions about coverage and bias. Coverage is the extent to which participation by the target population achieves the level specified in the program design. So coverage is basically just, is the target population receiving the services? Are they participating? And then bias, if you take the target population and break them into subgroups, and subgroups can be based on geographic location, it might be race-based subgroups, ethnicity-based subgroups, gender-based, girls versus boys or males versus females, class-based, wealthier segments versus less wealthy segments. So when you're talking about subgroups in a population, are certain subgroups being served more than others or better than others? And that's an issue with bias. Sometimes this is what we call self-selection. And self-selection, when you're analyzing a program or evaluating a program, can actually be what we call a validity issue. That's a methodological term. And what that means is, and we see this actually kind of a lot. So if you get, let's say, a voluntary program like a boot camp program, So you say, okay, instead of having time in a juvenile detention facility, a juvenile has the option to go through a boot camp program. But the boot camp program is voluntary. And then someone evaluates it and says, wow, compared to people who stayed in the detention center, the boot camp kids did a lot better. These boot camp programs are outstanding. We should have more of them. There could be a problem with selection bias. If it is voluntary, it might be that kids self-select into the boot camp program because they generally are more motivated to succeed. Maybe they come from better family backgrounds, or maybe they have more to lose by being in a detention center in terms of college prospects or job prospects or athletic prospects or networking in a community, familial support. So you might take kids who are more self-motivated or have better and stronger resources in terms of education, job, networks, family and friends support, where the kids who are saying, no, I'm not going through a boot camp program, I'll sit in the detention center, I really don't care. Perhaps it's not the boot camp program itself. Maybe those other kids would have been more successful anyway. So there's what we call a self-selection bias, where kids who are more prone to succeed self-select into the program. So it looks like the program is what caused the success, but in actuality, those were the kids who probably would have succeeded anyway, even had they all been in the detention center or had they all been in boot camp. That same group of kids would have succeeded anyway for the reasons that I mentioned. So that's what, when your book talks about a selection bias, and you'll hear that term a lot in research methods, that's what they're talking about. It's kind of a separate note, but something, when I was reading through the book chapter again, something kind of interesting that struck me is, that panel discussion that we're going to have on Tuesday. I sent you guys the email about it, the physician aid in dying. One of the questions, and I think it's the last one. So we're going to ask the panelists at least 4 questions. And if there's time for a 5th, then we're going to ask a 5th. And the 5th question actually talks about, now this isn't a program, it's a law, but the law that allows people to obtain prescription medication to end their lives. Now, of course, it's restricted to terminally ill patients. From doctors, one of the criticisms is that this entire issue is basically a rich white person's issue because there's actually a couple of sides to this. And one of them is actually going to be integrated into the 4th question, which will be asked in terms of, are certain racial, ethnic, and class groups, do they have more access than others? So is there a bias in terms of who will have the ability to take advantage of this, if you want to call it a privilege? So it raises kind of the same issue of, and there's a bunch of stuff going on within this issue in terms of, insurance, having insurance to pay for treatment versus not. So if someone doesn't have insurance coverage to pay for treatments that would extend his or her life, then they may be inclined to say, okay, I'm within 6 months of dying, I'm gonna take advantage of the end of life option. So there are a couple of issues with coverage bias within even that issue. So just in terms of access, if you have a program, and say, like, even think about charter schools that don't have busing systems. If you don't have the ability to take your child and pick your child up, or put the kid in a before or after school program where there's transportation provided from that program, but you as a parent would have to pay for that program to get you'd still have to get your kid there before school and then pick the kid up after school, then charter school is not going to be an option for some people. If you've got 2 parent working homes and there is no flexibility with either parent's work schedule, then a charter school or a private school wouldn't be an option for those kids. They would have to be able to get on a bus to go to a public school. So when you're thinking about access issues, those are the types of things to think about. So even if a program in theory doesn't shut out anybody based on race, class, gender, religion, nationality, or any other factor, that there still can be many more forms of subtle bias that take place. Um, it can be a challenge to determine the specific number of people in the target population who actually need the services of the program, but doing a needs assessment can help. So the needs assessment can identify who needs the program, and then within a certain area, how many people are in need. It may or may not provide an actual answer, but it can at least provide some guidance. You also can estimate problems with undercoverage or overcoverage, and your book talks about what those mean. Undercoverage is if part of the target population who needs the service is not receiving the service, and then overcoverage is when program participants who don't necessarily need the services are receiving them. And you can estimate problems with undercoverage or overcoverage by looking at records that are kept by the program, but you need to make sure that their records are up to date, reliable, and accurate. And the book talks a little bit about auditing. That's something we're not even going to get into for our project. We're going to have to assume that the records that are kept are accurate, reliable, and up to date. You also can do surveys, and which is one of the things that we're probably going to do. I think that we are going to be able to survey the staff, the teachers, and the therapists for both process and the impact evaluation. Assessing bias, I mentioned before, this was a validity issue. You can identify the subgroups in the target population to be able to assess full versus partial versus no participation. So if you get people or groups that are disproportionately not participating at all, why are they not participating? Did they drop out partway through? Is it because they're not participating because they don't have access to it? There's an issue with transportation, or they were unaware of the program. Is it an issue where they left the program because they were dissatisfied with it for some reason? If there's partial participation, what's going on that's causing partial versus complete participation? I mentioned before that we talked about monitoring service utilization and then also monitoring organizational functions. So moving now into the organizational functions, this gets into a program's use of resources to accomplish its tasks. And remember early on in the semester, we talked about theory failure. So this is when you think something is going to work based on X, Y, or Z, but it doesn't because your theory is wrong. Or implementation failure, where, yeah, theoretically this should work, but you're not implementing it the best way to make it work. So if you say, okay, I want to give people an opportunity to earn a higher income. We have a lot of people who are underemployed in a certain area. We want to reach this target population. We are going to provide vocational training services free of charge. We're going to offer it 5 times a week for 3 hours a day. But the time you offer it is noon to 3. Okay, so the problem, is theoretically, yeah, if you provide people with very specific skills and maybe a certification of those skills, they should be able to get a better job. But if you offer it from 12 to 3, maybe the target population can't participate then. If they're underemployed and working, those are actually standard work hours. If they're working during that time, which a lot of people probably would be, then there's a problem with the implementation. Maybe you need to do it in the evening, or maybe you need to do it on the weekends, or maybe offer it different times, different days. And that would be an example of implementation failure. And there are many, many, many ways that a program can fail in terms of its implementation. And it can involve not having the intervention or not doing it sufficiently. It can involve doing a wrong intervention, or what your book calls an uncontrolled or unstandardized intervention, which is where different groups or different people within the target population receive the services differently. The program delivery should include specification of services and accessibility. The specification of services involves planning and monitoring purposes. This is when the evaluator should lay out the services in operational or measurable terms. So operational here is a methodological term. When you operationalize something, you define it. So to say, I want to operationalize parent satisfaction with the program. The operationalization would be the actual survey questions you would ask to parents. To what extent did you find the evening program on effective discipline, to what extent did you find it useful? 1, not useful at all. 2, not real useful. 3, somewhat useful. 4, useful. And 5, very useful. That's operationalizing it. It means that you are defining what something means. So to say, I want to measure good health, how do you operationalize that? Or like a healthy, if you're talking about a service, the nutrition program. Okay, what is that? What is that service? Well, it involves the provision of organic meals that don't contain fried food, blah, blah, blah. And you would describe that program. That's the specific service defined in operational or measurable terms. Where possible, it's good to attach a monetary value to the services, especially if you're going to do a formal cost-benefit analysis. We're not doing a formal cost-benefit analysis, but we are going to answer the question, or at least address the question of, are the resources and inputs into the different services worthwhile given the outputs or the benefits? So it does include a little bit of a cost-benefit analysis. So if you have access to, if we are able to obtain information on the monetary cost of specific services, it would be great to have that, but it's not going to be necessary for us to fulfill our evaluation. So that's something to keep in mind. If you can find a way to get at that information, you might make a note, ask Danelle, or look it up online to look at the inputs, including the monetary value, so you can address the question of the value of a service. It's when you're specifying services, it's easy if you can do that in really simple, specific terms, just because the services then are easier to identify, they're easier to count, they're easier to record. So we talked about program delivery, including specification of services and accessibility. The accessibility is the extent to which the structural and organizational arrangements facilitate participation in the program. And that can mean different things for different programs. So for something like Children's Outreach Project, to my knowledge, they don't provide transportation to their school. So that's not, it might be an access issue where if parents can't bring their kids there, they're simply not going to be able to reach the program. But I don't think that we would recommend, the program should, go pick up kids from all over the place. That wouldn't be feasible. But in terms of accessibility, do all of the kids within the school have access to speech therapy, occupational therapy, the healthy meals, parent education programs, things like that? Those are the types of things that you would want to look at. Structurally and organizationally speaking, do the kids have access to the same benefits? So if a child is receiving therapy, what is that child not receiving at the time of therapy? Is that an access issue? Are they missing something really important? I know that there were a few references made to therapists working with children within the classrooms, but when children are pulled out of their classrooms, are the kids who are in a classroom receiving a similar type of education or service, but the child in therapy is just receiving that same benefit in a different way? Or is there something going on where a child is missing something that other children are receiving? So like I said, the accessibility thing can mean different things for different programs. It can involve just having office hours at a good time. It can involve recruitment and marketing. Are your recruitment and marketing strategies reaching everyone in the target population? If you're doing a mailing, what about people who are homeless? If they're a big part of your target population, mailing is probably going to cut out a pretty big part of your target population. It can involve transportation to the site. It can involve what efforts does the program take to minimize dropouts. And then the last part of this chapter talked about analyzing process evaluation data, and this is also going to be really important for what we're doing. So part of the analysis, and probably the biggest part of our analysis of Children's Outreach Project, includes a description of the program's operation. The description needs to be full and it needs to be accurate. We can use website data. We can use email exchanges or phone correspondence with Donnell. We can ask survey questions to staff, therapists, teachers, Donnell. This also should include estimates of coverage and bias and participation. It should include information on the types of services delivered, the intensity of services given to participants. So intensity might mean how many hours, and then of the hours. So if a child is receiving 1 hour of therapy 3 times a week, is it 60 full minutes of therapy, or is it 15 minutes of getting the kid to settle down, and then 10 or 15 minutes of therapy, and then a break, and then another 10 minutes of therapy? So it might be in terms of contact time, but then also actual therapy time. So when we're talking about intensity of services, again, think about how you want to measure or operationalize that. The reactions of the participants, I'm not sure that we're going to have access to that. I don't think we're going to be allowed to interview the children or to survey them or even really to observe them. We can check their files. I still have not received information. I asked Donnell to send me a blank piece, like a blank form, so I could see the types of information that we're going to have access to. She hasn't done that, which is no big deal. I mean, even if we wait until the site visit, we can just look then to see what data we'll be able to keep. There is a possibility, depending on the types of records they keep, that we'll be able to look and say, okay, this child seems to have issues with the therapist or with therapy. There are a lot of reports and documentation of a dissatisfied or an angry child versus, oh, this child seems very satisfied and is. You can't really say progress, because progress and satisfaction are 2 different things. But this child, there's documentation that the child is happy and has a great relationship with the therapist. I don't know that I don't know that they keep that kind of data, so we may not have access to it. And if we don't, we don't. There are plenty of other ways that we can describe the program's operations. If there were multiple sites in Children's Outreach Project, there's not. There's just the one site in Denver. If there are multiple sites, then you can compare between the sites and say, okay, how is the program implemented in this area versus this area? And then you could look at the diversity in implementation and also in outcomes. You can look at differences in staff, administration, the targets, the surrounding environment. And that can facilitate efforts to achieve standardization, assuming that's desirable. We can't do a site comparison. What we could do, and if you guys need to, you're assigning roles, like, okay, there were 8 roles and 10 people, maybe assign a person or 2 to say, okay, look at other similar preschools that are designed to help low-income families and take a look at how they're implemented. Maybe other evaluations have been published and you can say, we've looked at other evaluations of speech therapy in a preschool or preschool in low-income areas and see what you can find. Look at other evaluations of the Incredible Years curriculum and see, okay, how does Children's Outreach Project compared to what other places and programs are doing. So even though Children's Outreach Project doesn't have multiple sites, there are still methods and mechanisms that you can compare what's going on in Children's Outreach Project with what's going on in other places. And then finally, conformity of the program to its design. If there are inconsistencies between what the program says it's going to do or what it should be doing and what it's actually doing, then you as an evaluator can hopefully identify why. Why do these inconsistencies exist? To what extent do they exist? What corrective mechanisms can be taken? This can involve an issue of a program not performing the functions that it's expected to, or maybe it's performing the functions but not as well as it's expected to. And the program at this point may need to alter its implementation or change the program design. And that typically it's more of an implementation issue than a design issue. But both the evaluator and the stakeholders involved in the program would need to keep in mind that both are options. As always, let me know if you guys have any questions. Hopefully this will help you, and hopefully as you were reading the chapter, you were getting some ideas or some some kind of specific guidance in terms of like, oh, you know, the book talked about this. I can make this translation to our evaluation of children's outreach project. And like I said before, I will post the video of the tour. In fact, I'll just do that right now. So look for that. If I'm not able to do it, I may need Rob to do it. Rob is our IT director. If I need him to do it, then I will have that up either later today or sometime tomorrow. He's usually pretty quick with these things. So look for that in the very near future, and just let me know if you guys have questions about anything.